Now, your questions answered about the coronavirus.
Angela Rozier is in the studio with an infectious disease doctor, getting as many answers for you as we can. Ange?
That's right. We're keeping him very busy today. Joining me is Dr. Kitonga Kiminyo, again, an infectious disease expert here in Palm Beach County.
Yes.
We're going to get right to the questions again because we have plenty of them. One of the questions on our Facebook Live a few moments ago, it came from Mariana. She asked, is it contagious in water, pools, or the ocean?
Well, that's a good question. We don't believe it is. Certainly, we wouldn't want anyone with active symptoms going in said pool or ocean, but no, we don't believe that would be a very convenient method of transmission.
All right, then, moving right along. This question is from Amelia. Can you speak on the risks if you are experiencing bad allergies, symptoms, and asthma and are between 9 and 35 years old?
Okay, good question. Again, that's a very specific population, but certainly in someone of that young age, our experience so far with COVID is that no, it shouldn't be specifically high risk if it's an otherwise healthy person with seasonal allergies. It wouldn't necessarily put you at higher risk. We're more concerned about people again with more chronic lung conditions and those over the age of 65.
I was going to ask you that. It would be a different answer.
Big difference, right. But I would say to answer that question, the risk is a lot less.
All right, then, and moving right along, here is Eric. He wants to know, is it true that heat, humidity will help stop the virus from spreading?
Well, I know that's a very optimistic idea. I don't think there's been any studies that have shown that. Certainly, we know that with other seasonal viruses, you will see some changes, but I don't think we can really say that with this particular virus. And again, the concern is proximity to someone who is or infected or is close to someone who could expose you to that virus. And that said, whether it's winter or summer, the risk remains.
And one more question I was asking you earlier on Facebook Live. Should we be panicking?
No. I think, again, we should stay calm. I think we need to use common sense practice as we've been recommending. And if we just go by those guidelines, I think we have a better chance at controlling the spread.
Because people have been rushing to local stores, stocking up on supplies, so they should just...
No, we believe that's unnecessary. We believe that the most important thing are the simplest things, right? The hand washing, no unnecessary hand to face, avoiding large crowds if it's a non-essential visit, and covering up your mouth when you sneeze or cough, and, keeping non-essential travel, out for now.
Perfect. Thank you so much. And again, if you have any additional questions for the doctor, we're going to do another Facebook Live in a few minutes, and then we'll be back here on air at 6:15. So keep the questions coming. Back to you, Mike.